All right, we are going to continue on with the nervous system. Yesterday we went over all of the different parts, the central and the peripheral nervous system and the different parts of the brain. What I would like to do is focus in on nervous tissue and talk about the parts of the neuron and how action potentials occur. So, the nervous tissue, they're called neurons, also known as nerve cells. What they're going to do is transmit messages. The anatomy of the neuron contains the cell body. It's like a typical cell that you would see. It contains a nucleus, it contains a metabolic center, it has mitochondria, it has all those organelles that you're used to seeing in a cell. But what makes a neuron really special is that it has all of these extra things, like dendrites. Dendrites are these tree-like projections from the cell body that are going to convey messages towards the cell body. So they're taking incoming messages from other neurons. The axon is then going to conduct the nerve impulse away from the cell body through the neuron until it reaches the axon terminal. At the end of the axon is when the neurotransmitter is actually going to be released, and the neurotransmitter is released into an area called the synaptic cleft. All right, so it's a little bit easier if I show you a picture of it. So what we have here is the cell body right in the middle, kind of like a normal cell. And then we have these projections coming from the cell body called the dendrites. The dendrites are going to receive incoming chemical signals from other neurons. The chemical signal called a neurotransmitter is going to dock onto a receptor right here on the dendrite and is going to start what's called an action potential. So it's kind of like the heart in that it's an electrical signal that runs through the cell, and it is going to be achieved through the movement of ions. And we're going to get into the details of that here today. The action potential then moves through the axon, through the axon, till it reaches the axon terminal. And at the axon terminal is when a chemical neurotransmitter is released. And then this is called the synaptic cleft right here, where the neurotransmitter is released, and it's going to dock onto another neuron and cause that neuron to undergo an action potential as well. So this picture is showing you two neurons synapsing. This is where they're synapsing right here. So let's say this neuron is going to receive a neurotransmitter chemical signal from a neuron next to it. It's going to dock onto the dendrites, and then an action potential is going to be propagated through the axon, and then that action potential is going to reach the axon terminal, and at the axon terminal, more neurotransmitter is going to be released into the synaptic cleft, and then those neurotransmitters are going to dock onto the dendrites of this neuron, and then the same thing's going to happen. An action potential is going to be propagated through this neuron, through this axon, down to the axon terminal. Another neurotransmitter is going to be released into the synaptic cleft, and it just goes on and on and on. And so that's how neurons are communicating with each other. It's chemical, then it's electric, chemical, electric, chemical. And so then when the neurotransmitter is released from this neuron, it's going to do what it needs to do, and then it's going to be reuptake back into this neuron right here. So it doesn't actually go through the other one. The other one doesn't keep it. It's going to get taken back up into this other one until it's needed again. All right, some other parts of the neuron are going to involve what's called myelin. Myelin is a whitish fatty material that's going to cover nerve fibers, and it's going to speed up nerve impulses. So it's going to act kind of like an insulation that's going to speed up nerve impulses. Then we have Schwann cells. The Schwann cells are going to surround the axons, and they're going to form the myelin sheath. The myelin sheath is made up of myelin. It's a tight coil of wrapped membranes. So really, all three of these words are kind of interchangeable. Myelin is the substance that makes Schwann cells, and then all the Schwann cells together make up what's called the myelin sheath. So they really are interchangeable. All right, and the nodes of Ranvier or Ranvier are right here. These are the ones that aren't covered with any of the myelin or the myelin sheath. Okay. This is where ions are going to flow into the axon and cause the action potential to occur. All right. And then we have what's called white matter and gray matter. So I'm kind of going back to the macro view of the brain. The gray matter is what you're going to see here. Remember, we saw the homunculus yesterday that showed you everything that this gray matter is responsible for. So you have gray matter here, and it's the dark colored substance of the brain, and then you have white matter in the middle. So just in case you're wondering what made them gray and what made it white, the white matter is the myelinated fiber. So the white matter is actually made up of a bunch of myelinated axons, and the gray matter are unmyelinated fibers and cell bodies. So really all of the signaling itself and the neurotransmitters are being released in the gray part, and then the action potentials are just being propagated along through the white part. All right, we have some supporting cells. So these are the cells that support and cushion the neurons. All right, so supporting cells are also known as neuroglia. And here are all of the different supporting cells. There's a lot of them. So in the central nervous system, you have astrocytes, microglia, ependymal cells, oligodendrocytes, and this is all the different jobs that they do. There's just like the support. So barrier between capillaries and neurons, protect, immune and defense, line the brain and spinal cord cavities, wrap nerve fibers, produces myelin sheath. So these are the cells that are going to produce the myelin sheath. And then in the peripheral nervous system, you have Schwann cells like we just talked about before, and then satellite cells, and these are going to surround the neurons and they're going to protect and cushion. And so I didn't want to get too far into all of these different neuroglia cells. I feel like just knowing about the Schwann cells and the myelin sheath is enough for now. But just so you know, you have cells that are surrounding the neurons that are going to do all of these things: barrier, immune, protection, and stuff like that. And then there's a picture right there. I love that picture. That should be a painting. Or maybe that'll be the tattoo that I get. Just kidding. I'm not going to do that. All right, classification of neurons. We have different types. So there's functional classifications. The direction the nerve impulse is traveling gives it its classification. And we've talked about this already. Sensory neurons are going to carry impulses from the sensory receptors to the central nervous system: vision, hearing, equilibrium, taste, smell, pain, pressure, and heat. So that sensory neurons, if you looked at an arrow, they're the arrow that's going towards the brain and spinal cord. Motor neurons are carrying impulses from the central nervous system to muscles and glands. We already talked about this yesterday, so this is a review. So motor neurons would be going from the central nervous system. Interneurons are what is within the central nervous system. So you have, this really should be organized in a different way. You have sensory, then interneuron, then motor. So if you're confused on that, just look back at yesterday's picture. It's a pretty good picture. So interneuron is going to connect sensory and motor neurons, and that's going to be like where the integration happens in the central nervous system. All right, let's talk about nerve impulses. Exciting a neuron. All right, I have a video here for you to watch. Not that, it's this. This is a video on action potentials that I wanted you to watch before we kind of jumped into it.
I've said before that a nerve impulse is an electrical signal that travels along the neuron, but it's not quite electricity as you may know it. Electricity is the flow of electrons, but in a nerve impulse we use the word potential to describe the movement of charged particles across the membrane of a cell. The charged particles flow like a wave down the axon, moving in and out of the cell. The movement is mostly of positively charged ions, not negatively charged electrons like you might imagine. Let's look even closer at the cell membrane. At rest, when a neuron isn't firing, there's a high concentration of sodium ions outside of the cell membrane, and also a high concentration of potassium ions in the cytosol of the cell. The sodium and potassium channels are gated and closed. Because of the difference in number of sodium and potassium ions, as well as the presence of negative ions like chlorine, there's an overall negative internal charge of negative 70 millivolts. The beginning of an impulse is marked by depolarization. This means that the voltage-gated sodium channel is opened and the sodium rushes into the cell. The influx of positive charges quickly shifts the electric potential of the membrane so that now the outside is more negative and the inside of the cell is more positive. This change in polarity will close the sodium gate. Nearby is the voltage-gated potassium channel, which will now open and allow potassium ions to flow out of the cell. The movement of these positive ions will repolarize the cell, allowing the cell to have a negative internal charge relative to the positive extracellular charge. The change in polarity will also close the potassium gate. At this time, you might think that the cell is ready to receive another signal, but it can't. If the sodium gates opened, the sodium ions would not move. In order for ions to move through their channels, they have to be able to move down the electrochemical gradient. The positive sodium ions aren't attracted to the positive environment outside of the cell, so they won't move. Another signal can't be sent until the sodium and potassium ions have moved back to their resting potential positions. But this means moving against concentration gradients, which means energy must be used. During the refractory period, the sodium-potassium pump will move 3 sodium ions out of the cell and 2 potassium ions into the cell with 1 ATP molecule. This must happen constantly and rapidly, so the brain uses a significant amount of your body's energy. In a matter of milliseconds, the sodium-potassium pumps will restore resting potential and another action potential can move through. Nerve impulses are actually waves of action potentials, which means ions are flowing in and out of the cell in a wave-like pattern. Because of the refractory period where sodium ions will not flow out of the cell by diffusion, action potentials can only move in one direction. They begin at the dendrites and they end at the axon terminals. This wave-like region where the action potentials are flowing are referred to as the local current. The flow of sodium through one gate will trigger the flow of sodium in the next gate, but sometimes there isn't enough sodium to trigger an action potential. Using an oscilloscope to display the membrane potential over time, we can see that sometimes the flow of sodium ions isn't enough for an action potential to occur. The internal region of the cell must reach negative 55 millivolts, the threshold potential, for action potentials to begin. If enough sodium ions are released to surpass the threshold potential, an action potential occurs. In the oscilloscope trace of an action potential, we can see where the sodium and potassium gates have opened. Here is the point where the stimulus occurs, and sodium gates open, allowing sodium to rush into the cell. This depolarizes the cell, causing the inside to become positive relative to the outside of the cell. This polarity change opens the potassium gate, which allows potassium ions to rush out of the cell, which rapidly repolarizes the inside to a negative charge. This can often become more negative than negative 70 millivolts and is called hyperpolarization or undershoot. This will be corrected during the refractory period, where the sodium-potassium pump uses ATP to restore resting potential. During this time, no additional action potentials can be sent, but once resting potential is reached, the neuron is ready to fire again. Thanks for watching this episode of Teacher's Pet. Don't forget to like and subscribe and
Okay. So that's a lot of information and a lot of different steps and kind of confusing. So what I'd like to do is go back over that information, and then you have that link there if you want to watch it again. So when a cell membrane is at rest, it's called polarized. And the reason why it's polarized is because the sodium-potassium pump, like I talked about on day three, the sodium-potassium pump, remember, 3 sodiums out for every 2 potassiums in. So if most of your positives are on the outside and you have some chloride, negative chloride ions mixed in with potassium on the inside, you have what's called a resting potential, in that the outside of the cell is positively charged and the inside of the cell is negatively charged. This is called polarized. So the inside is negative compared to the outside. All right, so that's the beginning. So resting state, polarized, membrane potential. All the sodiums have gone to the outside, the potassiums come to the inside. You still have negatives in the inside, so the net charge inside is negative, the net charge outside is positive. So what do those positive charges desperately want to do in order to achieve equilibrium? They want to rush into the cell. So if a door opened for those sodiums to rush back into the cell to achieve equilibrium, they are going to do that, and that's going to naturally occur. So a stimulus comes in and excites the neuron. When it excites the neuron, a sodium channel opens, and remember, because of that difference in charge, sodium's going to want to rush into the cell, into the neuron, and at that point the neuron is what's called depolarized. It's becoming more positive inside now as sodium rushes in. Okay, the depolarization is going to activate the neuron to transmit an action potential. So as you saw in the video, once a threshold is reached at negative 55 millivolts, that's when the action potential, it's like an all or nothing phenomenon. The action potential is now definitely going to occur, and the impulse is going to be conducted down the entire axon. Once, I think it's positive 50, hold on one second. Once, I'm looking at my chart, I want to say it's positive, no, I'm sorry, it's positive 30. Once positive 30 millivolts is reached, sodium channels are then going to close, potassium channels open, and now potassium is going to want to go out of the cell. And what it's doing is repolarizing the membrane. So much positive has come in, now potassium wants to go out and it wants to reverse that. That is the action potential. Sodium comes in, potassium goes out, that's the action potential. And it's kind of like that wave thing she was describing. And then the refractory period is when the sodium-potassium pump is going to restore everything to its natural, what it was before. 3 sodiums out for every 2 potassiums in. It now becomes more positive on the outside, negative on the inside. And that's confusing. I remember being, oh my gosh, 3rd year college, taking a class and still just being like, I just really don't get this. So it is difficult to get. So let me show you some visuals. I'm going to go back over what I just said. So these are all the words. Now let me go over the visuals. I'm going to go back over what I just said. So the sodium-potassium pump is going to use ATP to pump 3 sodiums out for every 2 potassiums in, causing a difference in positive charge, meaning it's going to have a net negative charge on the inside because you have chloride ions that are negative mixed in. So the net charge inside is negative. The net charge on the outside is positive. And so we're going to say that the charge on the inside is negative 70 millivolts. So this is the resting membrane potential of a neuron. This is a neuron at rest. Negative inside, positive outside. All right? It's the sodium-potassium pump that's going to achieve resting membrane potential. So this is showing you those 3 sodiums out for every 2 potassiums in. And then when you mix in the chlorides, the negative chlorides into this, it's going to be negative on the inside, positive on the outside. All right, here is a stimulus. This is like a needle. Ooh, we could use your blood typing exercise. So when at least when I use the Lancet, so sorry, you guys got kind of a really thick Lancet, and it was kind of long too. So when the Lancet hits your finger, immediately what happens is those sodium channels open and sodium starts rushing into the neuron. And that's called depolarization. So, this is a great time to bring this up. When you go to the dentist and you get a lidocaine shot in your mouth, the lidocaine blocks sodium channels so that the neurons cannot depolarize. So that's why the pain sensation never actually makes it to your brain whenever the lidocaine is still working. So that's a great place to put that little tidbit in there. And so basically what this picture now is showing you is gated ion channels for sodium potassium. Just giving you kind of the basics of the gated ions for sodium and potassium. So you have what is chemically gated, and then this one is voltage gated. So this is just showing you when a neurotransmitter binds to a receptor, sodium and potassium can simultaneously go in and out. But the way that an action potential actually works is it's reliant upon the voltage. So you see right here in this picture, it's positive on the outside, negative on the inside. And so when a neurotransmitter binds, it then is going to open up this channel, allowing sodium to come in. And then when enough sodium comes in, it's going to close this channel. So this one's voltage gated. So while this one right here is dependent on a chemical, how the action potential really works is it's dependent on the charge. So the charge of the neuron is going to open and close those channels. Hopefully that kind of made sense. All right, so here are the actual steps. Resting state, more sodium on the outside, more potassium on the inside. It's actually a net negative charge on the inside, a net positive charge on the outside. A stimulus occurs. So this is what it's showing you right here on the little graph. A stimulus occurs and sodium channels open, sodium rushes in, that's depolarization, then sodium channels close. Potassium rushes out, that's repolarization, then potassium channels close. Well, hyperpolarization is still potassium leaving, and then potassium channels close, and the sodium potassium pump is going to reestablish membrane potential. It is really confusing. All right, and so what this is showing you is that graph that was in the video. And this is showing you, this is the voltage. So you have negative 70, which is resting. And then an action potential is going to go all the way up to positive 30 millivolts. So we have resting potential right here. Okay, action potential is not yet started. And then a stimulus occurs, sodium rushes in. So what this is measuring is the charge on the inside of the neuron. So charge goes up, sodium rushes in, sodium channels close, and then what here is showing you potassium rushes out. A little too much potassium comes out, that's hyperpolarization, then potassium channels close, and then there's a refractory period where the sodium potassium pump is going to reestablish that membrane potential. Okay, so there's an additional video to help you understand action potential. I've given the link down at the bottom. If I have enough time here at the very end, I will show it to you, but I'm going to kind of move on from here because let's talk a little bit about nerve conduction. So what happens at the end of an action potential? So at the end of an action potential, so it's propagating along, there's that wave of charge through the axon. It reaches the axon terminal and a neurotransmitter is released at the synaptic cleft. So I love this picture right here because it gets really into, so here is the end of one neuron and then the beginning of another. So this is the end of the axon of one neuron. This is the dendrite area of another. So the action potential arrives at the axon terminal. Calcium channels open, and when calcium channels open, it allows for neurotransmitters to be released, all right? And the neurotransmitters are released in vesicles. So this is a really good example of exocytosis. Those neurotransmitters are released here in the synaptic cleft, also known as the synapse. They diffuse across the synaptic cleft and they bind to a receptor on the neuron that it's signaling. All right, the binding of the neurotransmitter then opens up the ion channels, and then what's going to happen is an action potential, and then that neurotransmitter that was bound to this receptor then leaves the receptor and goes back to the neuron that it came from because it did its job. It started the action potential in the next neuron. Now it just goes back up to the neuron it came from. Right, so neurotransmitter, NT means neurotransmitter, diffuses across the synapse, binds to the receptor of the next neuron. The transmission of a nerve impulse is an electrochemical event. So a neurotransmitter is released, binds to a receptor, causes an action potential in the next neuron. Let's talk about neurotransmitters. There are 50 plus that have been identified. They can either be excitatory, which they cause the depolarization, or they can be inhibitory, which means they reduce the ability to cause an action potential. All right, our examples of neurotransmitters are acetylcholine, serotonin, and endorphins. And I'm going to talk about each one of those in just a minute. And so this just got cut off here. So if you can kind of see down here, I included this one because this one is really important for someone who is experiencing a mood disorder like anxiety and depression. You have what's called noradrenaline, also known as norepinephrine. And norepinephrine is going to be involved in your motivation. It can cause anxiety and irritability, but by itself, it can cause anxiety and a lot of motivation. All right, serotonin is going to be involved in appetite and mood. By itself or in conjunction with norepinephrine, it can cause a lot of anxiety. Dopamine is where you're going to get the pleasure and enjoyment of things. Okay, and so what I'm trying to convey here with this chart is each of these are important for their own specific things, but they have to work in conjunction to regulate healthy cognitive function, mood, and emotion. So I think of norepinephrine as being anxiety, motivation, serotonin as being anxiety, mood, and appetite, and then dopamine as being pleasure. You have to have all of those things working together. And so if you go to a psychiatrist, they're going to try to figure out which one of these is off and how can we treat that if a person is having mood disorder or some kind of anxiety or depression issue. So I thought that was just important to note that they work in conjunction together. So here are your main neurotransmitters. Acetylcholine is going to be responsible for muscle contraction, and it can be affected by botulism, curare, which can be paralytic, and nicotine. Dopamine is your feel-good chemical. It can be affected by cocaine and amphetamines. Methamphetamine is an amphetamine. The drug Adderall is an amphetamine. Ritalin is an amphetamine. Those are all kind of do the same thing. I worked at a pharmacy in Dallas. Yes, this was in Dallas. We actually had methamphetamine tablets in our vault. I actually didn't know that they even prescribed methamphetamine anymore for ADHD, but you have those older doctors that are still stuck on what they used to prescribe like back in the early 1900s, I guess. And methamphetamine is something that used to be prescribed for ADHD, and apparently at the pharmacy I worked at, they had a prescriber that was sending patients to us to get methamphetamine tablets. I mean, whatever works, right? All right, serotonin is going to regulate sleep, appetite, nausea, mood, migraines. Your drug Prozac is going to be a selective serotonin reuptake inhibitor. It's used for depression. LSD is going to have an effect, and ecstasy is also going to have a major effect on serotonin, the neurotransmitter. You will find out about that in Mouse Party today, so stay tuned. Endorphins are going to inhibit pain. You naturally have endorphins that get released. This is the reason why, if you've ever wondered, why does a person that cuts themselves do it? Well, this is why. They have a major release. Everyone has a release of endorphins when they get cut or when they have an injury, but a person who is prone to cutting will have a major release of endorphins, and it actually can cause a high and a diminishing of anxiety for them. So it's almost like a drug. So a person that cuts, and I don't know to what extent because I've never experienced it before, but I can imagine that it would have a similar effect to a drug like morphine or heroin or methadone. So it's like an addiction, and it's a coping mechanism to cope with a mood disorder. If you have a mood disorder and you're in a lot of psychological pain, if you know you can cut yourself and you can get relief, a person will do that if it's that bad. So just we just need to have compassion because that there actually is a physiological reason for it. GABA is the major inhibitory neurotransmitter, and GABA is released when you drink alcohol, take Valium, barbiturates, Xanax, Klonopin. I mean, there's a whole slew of drugs that cause a release of GABA, but Valium and Xanax are the most commonly the most common drugs, well, alcohol is common too, but they're the most common ones that are going to be prescribed for anxiety, because if you inhibit your neurotransmitters like serotonin, norepinephrine, then you inhibit a lot of anxiety. The only problem is a side effect of Valium and Xanax can be depression. I've heard a lot of people say Xanax is prescribed for depression. No, 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 never, ever. What it will be prescribed for is just anxiety. Now, someone can have a co-occurring psychiatric illness of anxiety with depression, and that's when Xanax can help out with that, but they'll probably need to take an antidepressant with it. But if someone with just depression takes a inhibitory drug, then they are going to experience depression even worse. All right, so noradrenaline and norepinephrine is the sixth one that I wanted on your list. This is part of the fight or flight response. It is part of the motivation, and it can actually be affected by some antidepressants and some ADHD medications. So some antidepressants are called SNRIs, which are serotonin norepinephrine reuptake inhibitors. Effexor and Cymbalta are examples of drugs that do that. And then there is an ADHD medication called Strattera. Strattera is actually a non-controlled drug, which it actually does not cause abuse. It doesn't have an abuse potential. You can't really get high off of it. It's a norepinephrine reuptake inhibitor, and so it can help with motivation and focus. It can help with ADHD. So I think nowadays a lot of psychiatrists are moving towards prescribing Strattera before they go into the more hard controlled Schedule II drugs like Adderall or Ritalin. Okay, our disorder today is multiple sclerosis. Multiple sclerosis is an autoimmune disease, which means the person's own immune system is going to attack something. And let me move this up. I can't seem to move okay, there you go, so you can see the beautiful picture. It's an autoimmune disease, which means the immune system is going to attack something. So what it's going to attack is the myelin sheath. And so the myelin sheath is there to increase nerve transmission and the speed of nerve transmission. And if it can't do that, then the neuron is not going to be able to function properly. So it's going to cause blindness, muscle weakness, speech disturbance, and urinary incontinence, which means a person cannot hold it. They'll urinate on themselves. Treatment are interferons and glatiramer. What it does is it holds off attacks. And so what these two drugs are going to do are just going to interfere with the immune system and with the inflammatory response. So it's kind of like a blockade between the person's immune system and the attack of the myelin sheath. And this is just showing you a picture of how the myelin sheath functions normally, healthy, and then how multiple sclerosis attacks occur. White blood cells attack neurons. There's a bunch of inflammation, and what they do, the white blood cells are going to break down the myelin sheath, so nerve signals can be slowed or blocked, and that's why a person blindness, so eyes won't work, muscles won't work, speech won't work, urinary incontinence. I mean, everything ends up affected. And so if you look right here, this is what a healthy brain would look like. And what ends up happening when the neurons get attacked like that, they end up dying and they form what's called plaques. So those are just like clumps of really messed up and dying neurons, basically. Okay, then that is all I have for you for neurons. What I would like for you guys to do is to go back and re-watch, because action potential is something that's difficult to understand. Re-watch that video, and there is another video that there's a link a couple of pages back, tinyurl.com/y5mevmg3, and that it's a 10-minute video, but it's another person explaining it. So sometimes it just takes another person. So I'll try to explain it, then I showed you the other video, now I'm showing you a third person explaining it. So hopefully you'll get a better grasp and a better understanding of it. And then your activity today is Mouse Party, which is everyone, it's fun, it's funny. I just can't possibly teach about neurons and not do Mouse Party. So if you've had me before and we've done neurons before, you have done Mouse Party, but you only did half of it. So I don't know if you remember, but I only required you guys to do 3 or 4 of the drugs. So if everyone needs to do all of the drugs, and if you've done this assignment before, I do have record that you've done 4 of them, so please, 3 or 4. So please go ahead and do the rest of them. And then those of you that are taking AP Bio next year, I will have record that you already did this entire assignment. So you're pretty much like you're doing an assignment for this class, and then it's also going to count for next year, because I'm not going to have you duplicate the same assignment. You will learn about neurons again, though, if you're going to take me again next year, because they are just so important. Cardiovascular system, nervous system are just so important, I think. They're all important, but I guess I prefer those the best. And I think that whenever I've worked in pharmacy, when I dispense drugs, it's always either a cardiovascular drug or a seizure drug, or something for depression or something for ADHD. It just seems like it goes back and forth between those 2 types. So I always am like, okay, this must be what people are seeing the doctor for most, cardiovascular and neurologic. So anyways, I will discuss Mouse Party a little bit more. I will go over action potential a little bit more in tomorrow's Zoom. I did a lot, 40 minutes for this lecture, but you are getting out in less than 36. So I will talk to you guys later. Bye.